Hello everyone, in this video we are going to discuss about pneumoconiosis. So what is pneumoconiosis? It is a chronic interstitial lung disease caused by inhalation of inorganic mineral dust. There are different types of pneumoconiosis. The first type is Coal Workers Pneumoconiosis. As the name suggests, the causative agent is coal dust. So what happens is whenever there is chronic exposure to this coal dust, as seen in coal workers, so there will be inhalation of these coal dust particles. So these coal dust particles will be engulfed by the alveolar macrophages. So this will cause macrophage dysfunction, and these macrophages will release the cytokines which causes inflammatory fibrosis. So there will be, the key features will be, there will be black lung, and they also can develop progressive massive fibrosis because of the release of cytokines. There will be fibrosis. Next is chest x-ray. On imaging we can see upper lobe nodules and also hyperinflation if there is any coexisting COPD. So the major complications are Kaplan syndrome, where there is coexistence of both rheumatoid nodules along with the pneumoconiosis. So this is Kaplan syndrome. So in this x-ray picture we can see there is a upper lobe nodules in Coal Workers Pneumoconiosis. So second type of pneumoconiosis is silicosis. So as the name suggests, the causative agent is silica dust. So these are seen in sandblasting and mining workers. So here whenever there is exposure to the silica dust, these will be inhaled. The inhaled silica particles will be toxic to the macrophages, and these will cause macrophage death. So there will be release of this interleukin-1 and TNF alpha. These are fibrogenic, so they will promote the fibrosis and cause nodular fibrosis. So there is also increased susceptibility to tuberculosis, and there will be progressive massive fibrosis. On X-ray we can see upper lobe nodules similar to the Coal Workers Pneumoconiosis, and also the characteristic feature is eggshell calcification at the hilar lymph nodes. And the major complication is there is very high risk of tuberculosis and also risk of lung cancer. So in this X-ray picture we can see eggshell calcification in silicosis. The next type of pneumoconiosis is asbestosis. As the name suggests, the causative agent is asbestos fibers. These are used in construction and also in the shipyards. So whenever this asbestos fiber, these are trapped in the alveoli actually. So the macrophages will attempt to phagocytose this, and these causes release of reactive oxygen species and also inflammatory cytokines, which causes fibrosis. So here there is the latent period, and also there is latent period because after chronic exposure there will be symptoms, and also we can see the features. So the features we can see are the pleural plaques and also clubbing. Here there is lower lobe fibrosis contrast to other pneumoconiosis, and also we can see calcified pleural plaques. The complications are mesothelioma and also bronchogenic carcinoma, and there is increased risk of pleural effusions. And also we can see ferruginous bodies whenever we do bronchoalveolar lavage, and these stain with Prussian blue stain. So in this X-ray picture we can see the pleural plaques. Next is berylliosis. So the causative agent is beryllium. It is generally used in aerospace and also in the electronics. So this causes type 4 hypersensitivity reaction. So this will cause non-caseating granuloma. So there will be non-caseating granuloma, so similar to the sarcoidosis. On X-ray we can see diffuse infiltrates and also hilar adenopathy, and there is increased risk of lung cancer and also chronic granulomatous disease. The next condition is the siderosis. So here the causative agent is the iron dust. Generally we can see whenever welding persons, there is increased risk of this iron dust exposure causing siderosis. So this siderosis is generally inert because this ferrous oxide which is actually inhaled is inert, and also it is phagocytosed by the alveolar macrophages. There is no inflammation, so there is no fibrosis also, because there will be no release of the cytokines. So it is a benign pneumoconiosis, usually asymptomatic. There will be fine upper lobe nodules, and generally no serious complications are seen in siderosis. So here we should remember one thing is lower lobe fibrosis is seen in asbestosis, and in all the other conditions majorly it is only upper lobe nodules and upper lobe fibrosis. Eggshell calcification of the hilar lymph nodes is seen in silicosis.